Well, I'd like to welcome everybody and let you know that you have selected the breakout session with the Robert Wood Johnson Foundation grantees. In this session, we'll be sharing strategies from projects across the United States intended to increase meaningful social connections and a sense of belonging. These projects reach a range of ages, diverse populations, and geographies, and are inspired by global solutions. And as our moderator today, we have Sharon Roerty. She is the Senior Program Officer at the Robert Wood Johnson Foundation. And Sharon, I'm going to kick it over to you to get us started.
Okay, there we go. Thanks, Meg. Thank you very much. And good morning, good afternoon, buenos dias, hola to everybody who's joined us. I'm really so happy to be beaming into your workspaces. But really, I'm happy to share with you our work, the Robert Wood Johnson Foundation's work on social isolation. For those of you who may not know about the Robert Wood Johnson Foundation, we've been around for about 45 years. We have a focus on health and healthcare. I'll talk a little bit, and today, social isolation is about health. The overview of this session, I'm going to talk to you a little bit about our work, our investment in social isolation. And then I'm going to introduce, we have 3 panelists with us today. I'm going to introduce them, and they are each going to give you a synopsis of the work that they have been doing in social isolation. And then we're going to have a discussion, myself and the panelists, then we'll have some Q&A with you, the participants. So if you have some questions, start scratching them out on your legal pad next to you, or whatever it is that you use. Okay, let's get into it. So we're committed to building a culture of health. Who's the we? It's the Robert Wood Johnson Foundation that I mentioned to you. We've been around for 45 years. And as I said, we focus on health and healthcare. In our early days, we really were focused a lot more on the healthcare part. But as we've evolved, we really think a lot more about health. We think outside the clinical settings. We're thinking in terms of communities, where you live, work, where you can thrive, really. Because we know that that's really what shapes our health much more than the healthcare settings. As we've delved into this work, we've talked about opportunity to be healthy in our culture of health, and we know that not everyone has the same opportunity, and that's all about equity. So with a deep equity lens, our commitment to building a culture of health is really rooted in the social determinants of health. And I will say that happiness and joy and a sense of belonging are really all parts of those social determinants of health. Next slide. So at the foundation, I sit on a small team. It's called the Global Ideas for U.S. Solutions team. It's really a learning and sharing team, or we go out into the world. That is when people could go back out into the world. It's a little less of that these days. But we look for things that are working. We look for the challenges that are happening across the world and what's working. What are those solutions that other countries are using that we could maybe use inside the US? So we call ourselves a learning and sharing team. In 2017, we launched a call for proposals designed to identify and adapt projects that were originally designed outside the US to address social isolation in the US. And that is social isolation across all stages of life. With that call for proposals, we received about 200 proposals. So it was really remarkable. And they were fantastic proposals. The proposals described by the applicants were adapted. The applicants were looking, let me stop. The programs that came back to us came from 44 different countries and addressed a broad range of socially isolated populations. And I mean, that really hit us. We knew that social isolation wasn't just or solely about older people, but the range of ideas that we got, the number of countries that we got the ideas from and what was working really was stunning to us. And so this report, this cover of the report that you see on your screen that really talks about our call for proposals, what we were looking for, what we got back, and then the solutions that are working, kind of a bright spot on the solutions, those solutions that our grantees are using, and then some other solutions that are working too, so that we wanted to share with you. So I really encourage you to go to our website. The link is on the screen. We could put that in the chat box. But the link to our report is there, and you can really see for yourself some of the ideas that we're borrowing from and that are working in the rest of the world. So with that call for proposals, we invested in 6 grantees. 6 may not seem like a lot out of 200, but it represents a $2.5 million investment. Our grantees come from, are doing work in Baltimore, Maryland, Oregon, Anchorage, Alaska. We've got grants in Wisconsin, Colorado, Buffalo, New York, Atlantic County, New Jersey. So they really are, they are somewhat across the United States. And the interventions, you know, even though they're happening in place, in the context of place, they are really systems-based interventions, and they can be applied across the country. And that's what we hope. We hope by sharing them that some of these solutions resonate with you. Again, you could pick up on them and use them where you are. And they also, these solutions, they represent populations, different populations, a broad spectrum of populations. We have youth, LGBTQ, families, new immigrants, incarcerated and returning citizens. We really very much intentionally went beyond seniors, not because we recognize that senior citizens do really also suffer from social isolation, but so does a broad range of people. And we wanted to look at those solutions that are working across the age spectrum. Our panelists will talk about their projects in just a few minutes now, and I'll give you some ideas. And let me introduce our panelists to you. Today we have Jonathan Garcia. He's the assistant professor at the University of Oregon and the director of the Global Health Program. His work has focused on devising community-led approaches to social isolation. Through his grant funds, he is engaging Latinx youth in workshops to address LGBTQ stigma and stereotyping. They are adapting role-playing scenarios inspired by telenovelas. Next up, we'll have Amanda O'Rourke. She is the executive director of 880 Cities. She is also currently co-chair of the Children Play and Nature Committee of the World Urban Parks. She is a planner, a biologist, a mom, and a committed optimist. And our third panelist is Yolanda Ogbolu. She is the chair of the Department of Partnerships, Professional Education, and Practice at the University of Maryland School of Nursing. She is also the director of the Office of Global Health within the department. Yolanda's research and scholarship focus has been on health equity, social justice, and improving the lives of vulnerable newborns and their families. I'm sure you'll enjoy hearing from each of them. And before we start, I want to thank our panelists very much for joining us. They are all really wonderful, and it's incredible the work they're doing. I also want to send out some love to our other grantees who are not on today's panel, but assure them that I will be reaching out to you for the next session that we do. And I want to send out some love to my colleague, Mary Joan Layden, who really got all of this work started at the foundation. So with that, Jonathan, I am going to turn it over to you. You've got about 5 minutes. Please tell us about the community solutions you are implementing in Oregon. Jonathan.
Good morning. Thank you, Sharon, for that wonderful introduction. And thank you for this opportunity to share our work at this really timely and essential action forum. The Engaging the Next Latinx Allies for Change and Equity program, or ENLACE, is seeking to transform the social context in 4-H, which is a positive youth development network, by training Latinx youth to become allies in solidarity with their LGBTQ peers. And the significance of our work is really based on intersectional social isolation that Latinx LGBTQ youth experience as ethnic, sexual, and gender minorities. These youth experience rejection from family members, religious communities, and from peers in schools. And so marginalization really affects their sense of belonging, their ability to engage and connect with others, and the quality of their relationships. And so our program was developed in collaboration with ABIA, the Brazilian Interdisciplinary AIDS Association in Rio de Janeiro. And I have my Rio de Janeiro Starbucks cup here to drink my coffee. The Brazilian program uses critical consciousness raising techniques, as you mentioned, role-playing workshops guided by videos to provide the skills needed to confront social isolation, stigma, and discrimination. Youth promote pride and solidarity as advocates for their communities to create an inclusive social context for LGBTQ youth living in favelas or shanty towns. And so we worked with community stakeholders here in Oregon, including Outside the Frame, an NGO in Portland that amplifies the voices of marginalized youth. And this program was made possible with funding from the Robert Wood Johnson Foundation. In the next slide, you will see a few of our pictures from our process of making telenovelas. The first describes the first phase, where we convened 45 community stakeholders, including Latinx LGBTQ youth, 4-H youth, Latinx parents, and health providers, to develop the themes of the telenovelas. So telenovelas are Spanish soap operas. Then we co-created these telenovelas with Latinx LGBTQ youth based on their own life experience. And this is one of the pictures of the youth filming the videos in a school about bullying. In this second picture, you see Cecilia and Cynthia, who are a parent and youth champion pair, because the greatest challenge in this project was to bridge understanding and relationships between Latinx communities, which sometimes have traditional religious values that are contrary to LGBTQ inclusivity, and Latinx LGBTQ youth who may experience rejection. We worked with parent and youth champions as spokesperson to generate community buy-in and recruit parent-child dyads for our workshops. And in this third picture, you'll see a screening at the Outside the Frame Gala before an audience of 400 people, where we showed our telenovela videos, this large audience of people from the community. In this current stage of our work, we are amplifying community voices in film screenings, conferences, podcasts, and 4-H workshops. Currently, we're also interviewing the parent-child dyads about their experience with social isolation during the pandemic, and we're adapting our workshops to an online format. We'll be piloting this online virtual intervention to examine the feasibility and its effects on self-reported social isolation and self-efficacy as LGBTQ allies. And I'll be highlighting a couple of lessons in my next slide that we've learned about addressing intersectional social isolation. And the first of these is that social isolation needs to be addressed by transforming the social context. This diagram was developed for our evidence mapping published in Global Public Health. It shows a range of contexts where social isolation among LGBTQ youth can be addressed. And the second lesson that I would like to highlight is that social isolation can be addressed by bridging commonalities among marginalized groups to form solidarity. This mutual identification based on experiences with isolation is evident in the following quote from a parent participant. She says, "Our children suffer so much because they lack identity. One of my daughters told me, 'Look, I don't feel like I'm Mexican and I'm not American.' So I asked, 'Why do you feel that way?' And my daughter said, 'I know that I'm Mexican because you and dad are Mexican, but I wasn't born in Mexico. I wasn't raised in Mexico. I don't know anything about Mexico. And I'm not American because I'm in the middle of all the white people and they're not like me. God, illuminate and help me,' exclaimed the mom, because kids suffer and they keep many things in silence. That's how LGBTQ people suffer rejection since their childhood, traumas from different situations. For the gay kid, it's triple, and it's seeing him as abnormal." As you can hear from parents' perspectives of allyship, they're grounded on some of the core values that resonated with their religious perspectives, including love, respect, and compassion. And I'll close with this. In our program, we're tapping into these core values and experiences with isolation as the greatest assets to generate solidarity. And so we're excited to be here and to discuss this project and others. Thank you.
That's my cue. Thanks, Jonathan, and thanks, Sharon, for the introduction. Bonjour, hello from Toronto, Canada, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat, and now home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. My name is Amanda O'Rourke, and I'm the Executive Director of 880 Cities. Thank you to the Coalition for inviting me, and for all of you for joining and listening in. 880 Cities quickly is a nonprofit organization. We're based in Toronto, but we work internationally. And for about 13 years, we've worked in about 300 cities around the world, challenging them to plan, design, and manage their streets and public spaces in a way that centers human health, dignity, and well-being for all. But I'm here to talk about Winter Mission, which is a program funded by the Robert Wood Johnson Foundation, as Sharon mentioned. In 2018, we embarked on this 2-year program, which was aiming to coach 3 US cities to plan, pilot, and implement creative solutions to increase social connection and physical activity in winter. We, in a nutshell, we really wanted to bring public life to public spaces in the wintertime, a time that we know that people tend to stay indoors. They kind of further retreat from social activities and physical activity in public spaces. We know there's an increase in loneliness and social isolation reported. And as Jonathan mentioned, the kind of compounding effects as it relates to social identities. So as I mentioned, this is funded by the Robert Wood Johnson Foundation, and it was delivered in partnership with the Winter Cities Institute, the city of Edmonton, which was our Canadian city model, work with the 3 US cities, as well as the Children in Nature Network. And we had some Nordic city partners who have been leading globally in this regard around promoting physical activity and social connection in winter in public space. So going into this project, you can go to the next slide. We not only wanted to challenge this kind of predominant negative attitude associated with winter and kind of defining winter as a problem that we need to solve, which it isn't. So we didn't want to blame winter. We think that really we're misdiagnosing the issue by blaming winter itself on exacerbating social isolation. But instead, we wanted to really focus on the underlying systemic issue, which is that our cities are really not designed, planned, or managed to promote winter life at all. And we know this because other countries with just as much winter and lack of sunlight do not have the systemic issue or increasing social isolation that we see in many American cities. So we know that social isolation is exacerbated because our mobility systems and our public spaces are just kind of generally hostile often to human beings. It limits mobility for folks who already experience challenges with a built environment that is basically completely ignored their needs. The pictures here, we know it intersects with a number of social identities, including race and gender, which play a key role in how people navigate public space. The picture in the top left, we know that women tend to walk more and also carry more of caregiving responsibilities. So when we have a mobility system that does not prioritize walking or clear snow for this mom to take her kid in the stroller, we're basically disincentivizing and making it more difficult, creating barriers for people to engage in winter and in public life. It also, we know our cities are designed in a way that disincentivizes transit and makes the waiting experience often unbearable and uncomfortable. This is the top right, a transit stop. it often feels, what we were seeing with cities is that when it comes to winter and sustainable transportation, cities have really kind of just given up. We're basically telling the person who waits at this bus stop that we don't care about you, we don't care about your needs. And we've observed similar patterns in parks and other public spaces. So the bottom left there, even on the most beautiful sunny days in winter, we see no kids using the playground. And we've often experienced with parks departments in many North American cities that the parks are unofficially closed in the winter as a kind of default policy. That means there's no maintenance, there's no activities happening in the parks at all, which is such an underused, great asset and so a piece of social infrastructure that we could be using better. And, we see also, as you can see in the bottom right, people with mobility challenges can often feel even further isolated when a big snow event happens, or in reduced temperatures where their equipment may not work well. So on to the next slide. We know it doesn't have to be that way. We worked with our 3 cities to engage folks in a broader conversation on winter and identify priority groups to come up with a strategy to address these issues. We reached out with new immigrants, racialized communities, youth, people with disabilities, and elderly residents. And we took all of these ideas and grouped them into major themes to come up with pilot projects in each of the cities that really came from this bottom-up grassroots approach. This is some examples of conversations we had, and simple ideas like a gear share library that allowed people to have equipment to engage in winter activities and park activations in the winter time. And last thing I just want to say is, the key thing that we learned from our process is that winter is a really great accessible topic to start a conversation around barriers that people are feeling around social isolation. I think engagement, we really just scratched the surface on engaging folks in the discussion and building new relationships that were really important to getting that systems change that we wanted. And I think we also, really revealed the larger systemic and structural inequalities at play, with best intentions to activate public life in winter. We also heard of really significant barriers for folks that connected to kind of racist structures and urban planning policies that were not designed to address these needs. But I'm looking forward to the questions and discussion as well. Thank you.
Good afternoon, everyone. I'm delighted to be here, and thanks to Amanda and to Jonathan for their discussion. Similar to my colleagues, I speak to you today from University of Maryland to discuss my study on family social isolation. I think that this study broadens the lens of social isolation to really focus on an underserved population, which is mothers or caregivers of children 0 to 5 residing in marginalized community. Evidence shows that the effects of social isolation are cumulative, affecting individuals not only early in life, but over the course of their life. We know that social isolation leads to notably poorer health for individuals 20 years later compared to those that are not affected by social isolation. In low resource communities like Baltimore, where I am from, the surrounding structures, how people fit into these structures, and the economic realities of life influence the degree in which a person is able to engage, form relationships, acquire and use resources. These conditions and the places where people live, learn, work, and play, many of you already know as the social determinants of health. I believe that given the risk of accumulation of social isolation over your life course, that addressing social isolation early in life with vulnerable families and children 0 to 5 years old could benefit both public health and well-being. Next slide, please. In our research study, we had two aims. One was to develop an in-depth understanding of community perspectives related to social isolation, and the other was to test the acceptability and feasibility of a culturally adapted social inclusion program from Brazil. For phase one, we completed a community engaged process. We had 5 focus groups and 14 stakeholder interviews. In this phase of the study, participants confirmed several things for us. One, that the unhealthy physical and social built environment limited their health and well-being. Specifically, their physical environment in which they lived limited their opportunities to a healthy lifestyle and to healthy social networks. Limited access to recreation and high local crime prevented them and their children from going outdoors, even when play areas were in close proximity. Many reported limited trustworthy relationships, which contributed to what we thought was self-isolation, where they limited their social interactions with family members and with very close family members. And individuals also weighed social isolation versus the risk of inclusion. And speaking to community members, we quickly learned, and actually community members helped us by introducing us to the term situational isolation. They explained that they were not socially isolating or self-isolating, but the situation and within their communities was really causing them to have to self-isolate. One couple described it this way: yes, I'm socially isolated. I live on a block with 20 row houses. 12 are abandoned. 4 have older women that are afraid to come out of their house. And after a man died from gunshots on my step, my family and I stay inside unless we must come out. Families reported that they do not play basketball in their neighborhood courts or participate in community life regularly because they fear they could be swept up by violence. We know that human life is naturally social, yet this way of life in segregated neighborhoods and cities greatly reduces both the quality and quantity of social relationships. These discussions with community members were frank and honest, perhaps in part because I shared that I was a native of that community. However, it was disheartening to see that my own experiences with social isolation in this community 40 years ago were still there. At the same time, community members were amazingly hopeful and offered potential solutions, which I'll share when we discuss further. We quickly learned that if we wanted to impact social isolation, we needed to leverage the resilience of community members, shift from deficit thinking about social isolation, and focus on building solutions. We changed our study name to Belong to Baltimore, a program that focuses on building social inclusion for families and children under 5. Next slide, please. In this final slide, I'll share a bit about our study, Belong to Baltimore. It's modeled after the Sal de Criança program in Rio de Janeiro, Brazil. The Sal de Criança program, or DARIA, is a 30-year-old program that has successfully tackled the problem of social isolation for vulnerable families of critically ill children. The program has assisted over 70,000 individuals and worked with the most marginalized families residing in favelas in Brazil. The most important characteristics of their program is that social inclusion is a central aspect of health. Social inclusion, which in our proposal we said is an antidote to social isolation, improves the terms in which our families take part in society, improving their ability, dignity, and opportunities. Similar to Sal de Criança, we address social isolation by improving family access to social resources in 5 key areas: housing, education, income generation, global citizenship, and health. Families participate in a 12-month intervention and are tracked over time. We're really excited about beginning the intervention phase of our study. We're in the very early phases right now, and we look forward to sharing data from the intervention in the future. Thank you, and I look forward to the continued discussion.
Wow, well, thank you so much, Jonathan, Amanda, and Yolanda. That was wonderful. So we've heard, just to sum it up, and I think we have Risa Wilkerson joining us too for this discussion. There's Risa. So y'all haven't met Risa yet. Risa is with Healthy Places by Design, and she too is working with the foundation to help make sure that our grantees learn across each other, and that we are sharing outwardly, as we are doing today, the solutions that we're finding, yeah, just lifting up the ideas. So want to say hello, Risa?
Hi, thanks for being here.
All right. So on our panel, just briefly, we heard about creating community power and agency through role playing. We heard about winter and the socially isolating effects of winter, but it doesn't have to be that way, because when we look outside to other countries, including our northern neighbors, Canada, and some Nordic neighbor countries, they certainly don't sort of pack it in, if you will, for the winter. We heard about family social isolation, and Yolanda, thank you so much for talking about situational isolation, and really shifting the focus to an asset frame, and even the fact that you changed your name to Belonging Baltimore. That's really quite incredible, and I think it's where we need to go. And I'm going to actually put this question then to Amanda and Jonathan, to talk about the importance of an asset-based approach to addressing social isolation. What strategies, if you can lift them up for us, that sort of changed maybe within your work, or how you framed your work, that were really focused on the assets within your community and that sense of belonging? If you would, maybe I'll go to Amanda first.
Yes, happy to. Thank you for the question. I think it's a really important one. The asset-based approach was definitely baked in from the beginning with the winter mission process, by how we actually even did the open call for applications. So I didn't have time to sort of go into that in my presentation, but we did an open call for cities who were interested, city teams actually, who were interested in being part of this collaboration with us, the Winter Mission Program. So we received 60 applications actually, and we had to choose 3 city partners. And I think the way that we framed it, where we focused very much on multi-sector, community driven initiatives, where not only did we have to have kind of display that there was political leadership that was interested in doing this program, but that there was an existing infrastructure around engagement with community. So Buffalo really stands out as in their application, they had identified their block clubs as key partners. So they had this existing relationship with community partners that really sort of brought their application to the top of the pile. Similarly, in Leadville, Colorado, they had existing great community relationships, as well as Eau Claire, Wisconsin. So I think from the outset, framing it as not just any city applied, but we wanted a team-based approach, multi-sector, collaborative, community relationships baked in from the beginning. And then from there, in the engagement and planning, really focused on existing priority communities and existing assets. So that's why the pilot projects that came out of the project were so simple and responsive to what were already there. So the Winter Gear Share is a great example, already using a library that was very well used to be able to provide gear to folks who needed it. The Winter City Guide was another example that many communities, 2 of our cities went with, because they said, actually, we have a lot of programs already, especially for newcomers. There's winter clothing and things for people to access, but there's no place for people to find this information in an easy way. So that's something that we would have never been able to come up with, but because it was so rooted in community experience, we got those great asset-based examples.
Great, thank you so much, Amanda. Jonathan, how about you? What was your thinking around assets in the community?
That's a really good question, and one of the things that we highlight is the telenovela approach is part of the Latinx assets. So culturally, that's one of the greatest assets. And then we have the institutional partners that we're working with, outside the frame, that amplifies the voices of youth and uses, draws on their own experiences to talk about social isolation and transforms their experiences with marginalization into actually their greatest asset to help other people that are experiencing marginalization. And then the third thing is our theoretical framework is based on critical consciousness theory and popular pedagogy, Paulo Freire's theory, which really taps into this idea of bottom-up learning and using cultural symbols and idioms from the community itself to teach others, and not from a top-down approach where we're doing didactically teaching from the top down. And so those are 3 ways that I think we're really, really tapping into assets. And so yeah, that's a really wonderful question.
Great, thank you, Jonathan. And Yolanda, I'm going to come back to you. And you spoke about assets already, but you penned a cultural health blog for the foundation on social isolation. But within that blog, you talked about the experience of COVID within your community. And we really haven't talked about COVID yet in this session. And certainly that has exacerbated social isolation in many, many communities and for many individuals. But can you talk about how your community kind of came together during and used some of the assets that you had during COVID to sort of counter what social isolation?
Sure. I mean, I'm very early on with COVID. There were lots of confusion around the language of social distancing versus physical distancing. And it was really important for us to distinguish that they were not the same, right? So we really felt that there was no need for people to feel more socially isolated in a community where we already knew people were socially isolated, and for them to begin to think about it as physical distancing. One of the great things that I think happened in Baltimore was really the amount of kindness that really radiated around the community. My program is grounded in thinking around upstream factors, lack of access to resources, and how that contributes to social isolation. And so part of our goal is to increase access to resources. And it was just amazing in Baltimore, whether it was companies like Comcast or Verizon that gave free access to internet to help break the digital divide that happens. It was also families telling me that for the first time, they didn't have to be hungry, that they were able to find food every day of the week, even on Sunday, because places like Baltimore City Public Schools had food deliveries. And so in this critical time during this pandemic, it's hard. It could be easy for us to overlook the kindness that is radiating. But indeed, I just took a few minutes to sit back and reflect on that in the blog, and we can share a link to that blog. Thank you for that question.
Great, thank you. And I know we've had some questions to our panelists in the chat box. And Risa, I think you have one to put out to our panelists from the participants.
Thanks, Sharon. It actually relates to a conversation we've all been having around policies and systems and an environmental approach. So we've been talking internally with you all and the other grantees about how the definition of social isolation typically uses an individualistic lens, and how important it is that we pull back out to that community view. And the question in the chat box is about what are the overt and subtle policies or historical practices within your local areas or that impact your local areas, which produce social isolation among marginalized communities. So just thinking about, as we've all been talking, kind of what we're learning about some of these true root causes of social isolation. Jonathan, would you like to start?
Yeah, sure. That's a wonderful question. Yes, so social isolation is a result of social context for us. And we have to consider history, policies, all of that as part of the social context. And in Oregon, for instance, historical ways in which people were oppressed included, Oregon was a white state for a long time. And also exploitation of migrant farm workers that come to Oregon to pick fruits and vegetables, but don't get the proper resources and don't feel a part of our society. And then you have on top of that, the isolation that happens for LGBTQ people. And not having school curricula that highlight LGBTQ history as a positive aspect of everyone's experience. And so when you have the intersection of racism, homophobia, xenophobia, and all the other systems of oppression that are instilled in our history and our policies, that's what generates social isolation. It's not about being timid. It's not about looking a certain way or having a certain identity. In fact, we're trying to really instill pride in identities with our project.
Thank you, Jonathan. Yolanda, would you like to add anything? And then I'll come to you, Amanda.
Sure. I thought about this and, given that social isolation, particularly in marginalized communities, is heavily impacted by the situation in which people live, certainly policies like redlining and others that have happened in the past have a direct impact on social isolation that we see in Baltimore now. I believe that any policy that relates to addressing systemic inequities and structural racism have the potential to have a positive ripple effect on social isolation. Within the state of Maryland, we do have policies that focus on racial reconciliation, the social determinants of health and health inequities. I would love to see that spread across the country. Because of COVID now federal government has also become increasingly aware of the social determinants of health as drivers for many adverse outcomes like social isolation. And so I do know that there's social determinants of health task force legislation under review at the federal level. I think these are important policies, and if supported and successful, could help to reduce social isolation in under-resourced communities.
Thank you. Amanda?
Yeah, I mean, Yolanda, thank you for that answer. That definitely is exactly what we sort of experienced with our project. This historical context of redlining in communities has been extremely detrimental for so many communities. And I also just want to, and I won't take long because I think everybody answered this question really well, but Risa, the big thing for that I would love to be able to communicate to folks is that these are really, and to sort of underline, is that these are larger systemic issues at play. Like this 5 decades of this social isolation epidemic or longer is not because people like socializing less. It's, there are these historical pieces that have led us to this point. So I think it's important for us to kind of wake up to this challenge, and I think maybe COVID has helped in that way. But I think the moving away from that individualistic definition of social isolation and really broadening it to that larger context that Jonathan talked about was so important. Even in our project, I think, an example that I often give is, working directly with undocumented folks and hearing how they experience winter. We came in with a question around, like, how do you experience winter? What are some of the barriers that you encounter in order to engage in winter life? And, similarly, the situational isolation was that they didn't want to be out in public space at all for fear of ICE raids. So, I mean, you know, we can do as much activation in parks and public spaces as we want, but unless we address those underlying root causes, there's no way that you know, folks will leave their private homes because of fear.
Yeah, I appreciate those answers very much. I'm going to turn it back to Sharon to take us to the finish line here. I would encourage people, if you do have questions or comments, go ahead and put those in the chat box. They will only be seen by panelists, but we're happy to make sure that everyone does see those, and we'll get to anything that we can in the hour, and appreciate your thoughts. Sharon.
Thank you very much, Risa. So, and thank you all. Those are great responses. Something you said, Amanda, I want to pick up on. You said social isolation isn't happening because people want to socialize less. Like something didn't happen in the human condition. We said, yeah, you know, I don't want to be connected, right? And yesterday in the opening to this two-day seminar, action forum, David Brooks talked about the loss of trust and how that's contributing to social isolation. And he broke it down like by decades, how, you know, we particularly all over, but in, you know, the loss of trust in institutions. And that seems to be a global phenomenon, very strong in the US, and a loss of trust even in our neighbors. So generally, you know, I was thinking, oh, when he said that in our neighbors too, but there is a loss of trust in our neighbors and our neighborhoods and, you know, people around. So that's exasperating social isolation. So, you know, so here's my question to you. In your work to reduce social isolation, what are you really aiming for? You know, in a couple of months, your grant, if you haven't realized this yet, you know, it's going to end. Sorry about that. And you're not likely to be renewed, any of you. Sorry again. But what happened? What are you aiming for in your work? What do you hope happens, you know, beyond the grant? What are you aiming for in your work? Because it's probably not, I'll take a guess, it's probably not to get social isolation down to zero. But what is it? What do you think you can do? And how does this work continue to build on itself within the community? So raise your hand. Who wants to be the brave person to go first? All right, Yolanda, you won. Go.
Thank you. I think at the end of this study, I hope that I've raised awareness of social isolations for mothers and young children. When I go through the report, even from NAM, I don't see any evidence or discussion of this population. So it's clearly been an understudied population when it comes to social isolation. I also hope that through our partnership with Brazil, that we would have developed a sustainable model that promotes social inclusion using a strength-based, community-informed approach. We have partnered with community organizations, Be More Healthy Babies at Promise Heights, as well as the Black Mental Health Alliance, and thinking about sustainability upfront after the grant ends. So our goal is really to increase community and family awareness, to equip them with skills to combat social isolation, to increase opportunities for them to get and learn how to get social resources for themselves. And I think we can move this vision forward by listening to the community members. I mean, they recommended creating safe spaces where they could meet and build trusting relationships with other people in the community. They also recommended that we could build bridges between Black women that were older in the community and younger Black women in the community. And that way there could be bi-directional and intergenerational reductions in social isolation. So I'm excited about the potential of what we can do in the future. And thanks for that question.
Great, thank you, Yolanda. How about you, Jonathan? What are you aiming for?
Yes, so I was aiming for a continuous grant for a lifetime, but since we can't have that. So our toolkit is meant to be sustaining because as we're piloting it in the context of 4-H and we're working with different organizations in Oregon that have contributed significantly to the work, we have not done this by ourselves. And so everyone has buy-in. And the 4-H network is one that's a national network. There are other networks that can also use our toolkit, including the Genders and Sexualities Alliances or Gay Straight Alliances. Some have one term or the other in high schools and some middle schools. And those are sometimes they're in the United States, but there are some in Canada as well. And so these various networks are able to use PFLAG, GLAD, the types of organizations that could use our toolkit. But we also want to become able to train advocates for changing these oppressive systems. And really what we're doing is building critical consciousness as a way to do that. So we see this as a stepping stone towards changing those systems of oppression by giving people the tools to do that.
Great, thank you. That's a really great answer. Amanda, what are you aiming for?
Yeah, I mean, I think a similar kind of approach that Jonathan mentioned, we, with each of the 3 cities, we are developing these strategy documents in collaboration, co-creating them to sustain this work beyond the life of the grant on a very practical side. We also have a toolkit for any city or community interested in sort of learning from the process that we did with Winter Mission on how to encourage more public life in public spaces in the wintertime, and our engagement approach, good practices for that. But ultimately, I would say, I think our biggest goal was to kind of challenge the existing constrained ways of thinking about social isolation and how it intersects with winter. In our working with a lot of cities around the world, I think that's often the biggest barrier, is like a failure to imagine things in a different way. And so I think what we've been able to do is to open up those mental models and open up those minds. And if that's been a check, I think we're nudging towards transformative change.
Thank you. Thank you very much, Amanda. So Risa, I'm going to come back to you and ask you, you've been working closely with us and with all our grantees to share an insight, something you've learned from this work, and something you think that maybe as a country even we could be aiming for, a solution that might work across the country. So please share with us an insight, Risa.
Something that'll solve it all?
Yeah, exactly. Let's I mean, we've got a lot of good things on the table here today. They're brilliant. What's Risa thinking?
I think that what I've been most inspired by in working with all of the folks in this group and others that are their peers is the collaborative approach. They're not only working collaborative with a global partner, but they're looking to collaborate and are collaborating very well and deeply with folks in their region and with each other. That's been inspiring, and I think collaboration is really going to be very critical for this going forward. And that's the whole point of this larger action forum, is to talk about a global collaboration, really. The other thing is that I'm so inspired by this group who've been talking about not only addressing the root causes, but really coming at this with an anti-racist, anti-othering mindset. And I think that conversation really has to stay front and center if we're going to talk about social isolation. And there are, I think, lots of opportunities and possibilities for that, but there has to be intentionality with it. And this group and their peers are very strong in that way. They're teaching me a lot, and I think have a lot to share out with others. So I'm hopeful that as this conversation, really blooms across the country and across the globe, that those things, keeping things from an asset-based approach, looking at things from an anti-othering approach, really looking at the root causes in this community level mindset is going to be a way that we can really see some change going forward.
Thank you, Risa. That's great. Yes. And that is, a bit of how the foundation is thinking too. Social isolation is an area of investment for us in terms of the global team and learning. We, by convening panels of global leaders and doers, they pointed us towards social isolation as saying it's not just in the US, it's all over the world, but people are doing things about it, right? they are combating this. They're trying to reverse the trend. And that's why we went out and learned and are investing in others to try to help us, you know, bring those solutions back to the US. It's not likely, I'll just say, you know, I think there's been some questions in the chat box about, you know, how do I get a grant? Well, it's not likely that we'll continue to fund in this area precisely on social isolation. What we are doing, again, is sharing, like we are today, sharing what we've learned. We'll continue to share it, and we'll build it into the work that we do. I said happiness, joy is a social determination, social determinant of health. That sense of belonging is a social determinant of health. The policies that all of our panelists pointed to, we're very, very interested in changing policy and changing mindset so that we all really can be healthy where we live, where we work, play, you know, where we, you know, thrive. So we can't thrive if we're socially isolated. So we're building it into our work. I want to thank all of our panelists today for sharing, for spending the time, for sharing what they're doing in their communities. I want to thank all of our participants. You know, we had some of our other grantees in this session with us. So again, thank you for all you're doing. Continue to watch the RWJ website where we'll share more information, and we'll share it on the organizations that we're working with. So thank you all. Have a great day. Yeah. Stay healthy.
Thank you so much, Sharon, and what a terrific discussion. And I want to point out that we are going to be sharing resources from the various programs that we heard about today. So if folks would like to follow up, you should be receiving an email with some resources to do just that. On behalf of the coalition, we just want to share our sincere thanks to the Robert Wood Johnson Foundation, to our moderator, Sharon, Teresa, and of course to our amazing panelists today, Amanda, Dr. Garcia, Dr. Ogbolu. Thank you so much. We're now going to be moving back to the main session for the final presentations, which will be a culmination of everything we have seen and learned over the last 2 days. So just simply click the link in the chat, and we hope to see you all there. And this will stay open for a few more minutes if anyone is having technical difficulties.